This is a video about bracing for scoliosis. Scoliosis refers to a curve of the spine. This is a common diagnosis affecting children. The following video focuses on idiopathic scoliosis, which is the most common type seen. Braces can be used in neuromuscular and congenital scoliosis, but the results aren't as well known. Your doctor will consider many factors before recommending a brace, such as the degree of curve, the progression of the curve, and the child's skeletal age. Braced curves are typically larger than 20 degrees. X-rays show how the scoliosis partially corrects when the brace is worn. The goal of bracing is to prevent progression and to eliminate the need for surgery, which typically occurs when curves exceed 50 degrees. This video is meant to show how to properly use a brace, the expected results of bracing, and to answer frequently asked questions. There are many different brace designs available, even more than what is seen here. Some braces are designed for day and night use, while others are designed to get more correction but can only be worn while laying down. We don't know much about the relative advantages of certain braces. The best brace for an individual is the one that gets good scoliosis correction and is comfortable enough to be worn as prescribed. Most modern braces share some common features. They are made by a trained orthotist based off surgeon's instructions. Most are a snug-fitting corset made of plastic or similar material. Braces can be tightened, loosened, or removed using Velcro straps located on the front, side, or back of the brace. They have pads or contour to apply pressure, as well as cutouts to allow relief and shifting of the curve. Adjustments can be made by an orthotist to ensure better fit or to accommodate small changes in body shape without making a new brace. New braces are typically needed every 12 to 18 months as the patient grows. Obviously, wearing a brace is a change for any child, but they may be more willing to wear the brace if they understand the positive effect it can have for them. Modern studies have shown that bracing can reduce progression of scoliosis. This means avoiding surgery. In this landmark study, of the patients who were not braced, 58% progressed to 50-degree curves, which is a size that generally requires surgery. Patients assigned to wearing a brace had only 25% progression. They improved their odds drastically. The researchers also kept track of how often children wore their braces, and not surprisingly, they found that the more a child wore their brace, the better their results. So wearing the brace 13 hours or more decreased the risk of failure to only 10%. Wearing a brace less than 6 hours per day is equivalent to not wearing one at all. Yoga, acupuncture, chiropractor adjustments, and other modalities may help a patient with back pain symptoms, but there is no evidence that they prevent scoliosis progression. Physical therapy regimens, even those specially designed for scoliosis treatment, also do not have rigorous evidence for their success. So for these reasons, we do not recommend relying on these methods to the exclusion of bracing. In certain patients, these may be good things to try along with bracing. Children may initially resist wearing their brace. Remember that this is a marathon, not a sprint, and gently increasing the brace wear schedule until you're at the prescribed dose is recommended. Be sure to praise your child and offer rewards for compliant brace wear, and discuss breaks and bracing with your doctor for special occasions and as a reward for good brace wear. To summarize, bracing is commonly performed, bracing is proven, and while daunting at first, many children and families have had success with bracing and have avoided spine surgery. Thank you for your attention.